Hi, I'm Dr. Anand from the Center for Vision and Eye Surgery, Chennai. I'm a cornea specialist and a specialist in dry eye and keratoconus. Today I'm going to speak to you about something that we have started seeing a lot more commonly among people over the last 2 years of the pandemic. It is called dry eyes, and it is something that we have seen a dramatic increase. It's not only for the software professionals who are on the system 8 to 12 hours a day, but also for young children who have now shifted to online classes. We are also getting a fair amount among the elderly who tend to see a lot of YouTube or even social media on the phone. So it's actually becoming a pandemic, and it is across all ages. Broadly, when you're looking at dry eyes, most patients who do come to us for a second opinion usually have been given some drops. Now, remember that dry eyes have multiple types, and there is no one size fits all. The dry eye treatment then needs to be customized to the patient's requirements. We do find a good number of patients who do respond to a customized treatment ladder, wherein we first try and find what type of dry eyes. Just to educate the general public, there are two types of dry eyes. When you look at what exactly is dry eyes, is probably the first question. Dry eyes is when the amount of normal tears in the eyes is on the lesser side. Now, the tear layer actually has three layers. One is the water component, the second is the liquid component, and third is the gel component. Now, the water part also is not only water, but also has some salts. The second part is the oily layer, which is consisted of basically different types of oils which are secreted by the tear glands in the eyelids. And the third is the gel part, which is also secreted by small glands on the skin, the conjunctiva of the eye. Now, what we find is almost 80% of the dry eye patients are the oily related dry eyes. Only about 20% are the aqueous, that is the water part being less. Now, this is important because just by replacing only the water part with teardrops, they would actually not respond. So they do need something beyond just lubrication drops, and there are multiple factors which can affect a patient. For example, a couple of days back, we did find a patient with rheumatoid arthritis who has chronic joint pains, had quite severe dry eyes, and then required a basic workup of what the level of dry eye is, because we treat as per the level of the dry eye. There are 4 levels, just to let you know, and at a basic level, usually lubrication drops do help. But what is important is not only the eye drops with lubrication, but do they have anything beyond that? When you're looking at 80% of patients requiring replacement of the oily layer, then it becomes probably important that you need to replace that as well, and that would require either looking at the tear glands that are present on the eyelids, called the meibomian gland, to see if they're open or are they closed. There are different tests to actually assess that. When you're looking at purely, when we say water deficient or aqueous deficient dry eyes, we do stain the ocular surface, the eye surface, with a special stain called fluorescein, and if there is staining of the skin of the eye, the conjunctiva and the corneal epithelium, and what we call SPKs or superficial punctate keratitis, it's almost as if somebody's taken a sandpaper and just kind of rubbed the surface of the eye, and that can appear as SPKs, and then patient does require some level of treatment. Usually most patients we see tend to have the problem in both the eyes. Very occasionally you can get patients who do not close the eyes well at night. We call that lag ophthalmos. That is when they are sleeping, more common among the elderly, where the lid doesn't actually close completely, and that can cause a lot of dry eyes, and a lot of these patients get up early in the morning with a lot of scratchy sensation as if the lids are stuck together. The second type of dry eyes is the computer vision, which can also cause this aqueous deficiency. That is, normally a person blinks about 15 times a minute, but especially among children or among people who work on the computers a lot, that blink rate comes down to hardly 5. So that is, the lid is open most of the time, and the tears tend to get evaporated. This can occur if you're constantly in an air-conditioned environment, if you have a lot of air blow on the face, that can also cause or evaporation of the tears. The other important thing is that you need to make sure that the blink is complete. Now there are nerves present on the skin of the eye, the conjunctiva, which are connected directly to the brain, and they basically stimulate the secretion of the tears. So even if you blink half, the brain is perceives it as being a complete blink, and then the secretion tends to remain the same. So it's important that you make sure that you think and blink, that is, make sure each blink is complete. Make sure you consciously take a rest or consciously blink while working on the system, because this is important. And of course taking a break, because every 20 minutes taking 20 seconds or a minute every half an hour is a good idea. This is extremely important among children as well. There is a subset of patients which are called autoimmune or age related, wherein you have associated with autoimmune diseases like Sjogren's, quite common, where you have dryness of mouth, dryness of eyes, and the whole body tends to be with less secretions. That can also cause a significant amount of discomfort to the patient, and these patients are also managed in coordination with internist. Rheumatoid arthritis, in about 30% of patients, tend to have dry eyes, quite common, and something that needs to be asked for. Usually a blood panel, if it's been done recently, does help to really look at it. Recently there's another important factor of dry eyes. What we find is vitamin D deficiency. This is important, especially among elderly, among children, even people who've been indoors for the last couple of years. So a vitamin D test is something I would recommend. It's something that you should do if you feel you have dry eyes, and of course vitamin D is relevant in a lot of other diseases as well. How do we treat? This is probably a very important part of the treatment. How do you treat? Beyond lubrication, you need to make sure you treat all part of it. First is diagnosing what type of dry eye is it. Is it an aqueous deficient, or is it a meibomian gland disease? That is the oily layer being deficient, and then treat according to that. So each part requires a separate level. As I said, there are 4 levels of dry eyes. Similarly, we have 4 levels of treatment. In the first level, we give lubrication, try and see if they can manage with homegrown supplements. We also try and give them some warm compresses to help open up the tear glands. If this doesn't respond, we do have possibility of actually looking closely at these meibomian glands and really checking how much of it is actually active. Is it 20%, 50%, grade it, and then treat with either warm compresses. We also can use something called infrared masks, which help to open up the tear glands. You can actually give heat and squeeze these tear glands to increase the tear flow, and this is not a one-time procedure. Usually most of them do require a checkup in 6 months to a year to actually check whether the response has been good. A lot of times you need to also look at hormones, especially among ladies when they cross 50 and there are hormonal changes, especially postmenopausal. There is these tear glands are actually fairly sensitive to the hormone levels of androgen and testosterone. So we find that ladies tend to have generally more dry eyes than males. Among children, this is important. We found a good amount of association with allergy, and specifically in the last 2 years we have a number of patients, especially younger than 16, who have associated dry eyes, who have associated allergy, and a coexistent management of both is extremely important to really make a difference. How long does the treatment continue? That's another common question. Usually we do start the treatments and keep them on follow-up. If the initial response is good, usually at least a couple of months to 3 months would be required. If there's an associated condition like arthritis or Sjogren's syndrome, then you're probably looking at a fairly long-term follow-up and treatment for that as well. In level 2, we do look at beyond just warm compresses. We do give supplements for omega-3 fatty acids. We find that to be helpful. We also give, along with warm compresses, we looked at punctal plugs. And there are now longer lasting tears that are available, which stay on the eye longer and actually give comfort to the patients. Usually the dosing is starting at 4, sometimes even goes up to 10 times a day. But probably what I feel is lifestyle modifications in terms of making sure you take rest, making sure you blink often, make sure you make a complete blink, making sure at night you do not keep the eyes open, check your general health in terms of vitamin D, vitamin B12 deficiency, and a combination of all this usually makes a big difference in the symptoms of the patient. But it's, as I said, a gradual process where you need to look at it closely and follow up at least every month for the first 3 months, because the summary of all that has come on the effect of the last 2 years, and of course excessive use over the last 10 years has actually brought this dry eyes. So it's not going to go away in a month or two. It does require at least about 3 months of follow-up to see what level you are and whether you would respond to treatment. If there's any other questions, I'll be definitely happy. Just leave a small comment and I'll try and definitely get back to you. Thank you so much.